Our consumer panel weighs in on diabetes. And could bison consumption actually challenge beef? Technology replaces the wine steward for April 6, 2011. This is Food News Today. Good morning. Immediately following Food News Today, we continue with a live discussion in our chat room below. I hope you'll join us. Feel free to type in your comments or questions throughout the broadcast. Food News Today is sponsored by ConAgra Foods, who shares with me the desire to provide the most current, interesting, and unbiased food news. In Health and Wellness today, we take a look at diabetes and what shoppers have to say. The federal fight against obesity, and in particular against childhood obesity, could help millions of Americans avoid the complications, pain, and expense of type 2 diabetes. The sooner the people eat smarter, the sooner they'll take themselves out of harm's way. Studies have shown that type 2 diabetes, previously called adult onset diabetes, can be prevented or delayed by losing just 7% of body weight through physical activity and through healthy eating, according to the American Diabetes Association, who also notes that African Americans, Hispanic Latinos, Native Americans, Asian Americans, Pacific Islanders, and others with family history of the disease are at greater risk for the type 2. Some proactive help from supermarkets could actually go a long way to help shoppers. Diabetes is insidious and can inflict internal damage quietly without blatant symptoms. Some 79 Americans, that's 1 in 3 U.S. adults, are pre-diabetic, reports the Centers for Disease Control and Prevention. Add to this the 26 million who are already diagnosed, the 7 million who have diabetes but don't know it, and the 16% of pregnant women who have gestational diabetes. It's time that supermarkets help consumers manage the disease and help them keep getting it. But are supermarkets doing their job? We asked our Supermarket Guru consumer panel how they shop with diabetes prevention and control in mind. 71% say they or someone in their household has diabetes or prediabetes. Only 41% say they or the person with diabetes always eats with prevention or blood sugar control in mind. 34% say they usually do so. After diagnosis, most people have to rethink their eating habits to include more dark green veggies, whole grains, legumes, and lean meats, but only 62% of our consumer panel say they've changed their dietary habits after being diagnosed. So what do they look for when shopping in the supermarket? Well, 33% focus on total carbohydrate content, 23% look at sugar content, 14% look at the glycemic index, and 11%, well, they say they're confused and not sure what to focus on. This is the opportunity for supermarkets. A whopping 66% say they would like more help from the supermarket in clarifying how to eat smarter with the disease. 43% say information signage would help. 41% would look to the websites for information. 33% want booklets. 33% would seek help from an in-store nutritionist or dietitian, and 12% would attend after-hour classes. Now, keep in mind that 64%, of course, are expecting this information at no charge. But here's another opportunity that 79% of the consumer panel say that they would find helpful: having appropriate foods labeled as, quote, helpful for managing diabetes. It's time that we all help promote the American Diabetes Association Join the Million Challenge. Now, this month-long campaign runs through April 22nd with a goal to have 1 million Americans take the free diabetes risk test online. Just visit stopdiabetes.diabetes.org. In today's tech story, we visit Smart Cellar, and yes, there's an app for that. Rather than a waiter or host just dropping off a hefty, daunting, and often outdated leather-bound wine list on your dinner table, a handful of restaurants have opted to aid in the ease of wine selection and education by using the technology combination of Smart Cellar and the iPad. Now, celebrity chefs and restaurateurs are a long list who are using this technology. Todd English at Olives in New York City, Wolfgang Puck at Cut in Las Vegas, Gordon Ramsay at the Claridge in London, Joel Robuchon at the Four Seasons in New York City, and Chef Jose Andres at the Cosmopolitan in Las Vegas are leading the charge. Patrons can browse via the device's touchpad for wines by name, region, varietal, and price. Guests can even view an up-close image of the bottle's label. Smart Cellar can even be used by the sommelier as a tool to educate, and guests can even order directly from the iPad to the bar and avoid human contact with the waiter. Some restaurants actually give guests the option to order food directly through the software, as well as suggesting wine pairings according to the dishes that they've ordered. In addition to being a hip, tech-savvy addition to the restaurant experience, Smart Cellar provides valuable data to the restaurant. And as you would expect, the reports give detailed feedback and monitor which wines are the best sellers. Now, we want to suggest that they go even a step further and become a true networking tool that the iPad can enable. Allow the guests to add their own comments and their own ratings to the wines that were selected. That way it helps everybody. In consumer trends, we wonder if Bison is the better burger. Ted Turner is one happy guy. Although he may no longer have Jane Fonda on his arm or be running CNN, he is the largest bison rancher in the U.S. And people are lining up at his Montana Grill restaurants where bison is a main staple on the menu. The popularity of bison meat is finally catching on as consumers are realizing that it has less fat and cholesterol and fewer calories for the same weight of beef, pork, or chicken. It's high in protein and good fats, and has a wide spectrum of vitamins and minerals. In fact, consumer demand is outpacing the available supply of bison meat, according to the National Bison Association. Sales have doubled since 2005, but the sector is still a small fraction of the meat marketplace. Listen to this. Last year, 53,000 bison were processed, 53,000 for the entire year under USDA inspection. Here's the comparison. The U.S. beef industry processes more than twice that amount, 125,000 head of cattle every single day. Now, the average American eats more than 65 pounds of beef each year, but the per capita consumption of bison is barely 1/10 of a pound. But now the ranchers are discovering a new reason to enter the bison business. Dave Carter, who's the executive director of the National Bison Association, says that demand is up, driven by its healthier nutrient profile, consumers' interest in where and how their foods are produced, and most important, the taste. Because bison is not a commodity product, ranchers are not locked into working with the pricing and marketing systems that are common in the beef and pork markets. So it begs the question, as beef and pork prices continue to rise, and they will continue, will bison become a more affordable option? By the way, the key to cooking bison properly is to remember that because of its low fat content, it will cook more quickly than beef, and bison is also slightly sweeter than beef. Let's head to our chat and see what's on your mind today. We've got some questions already in our chat room. Claire is asking, do you think the new menu and vending machine calorie labeling will affect our supermarkets, maybe front of package? Claire, absolutely. There's no question that the government is getting heavily involved in menu labeling and front of package labeling. Now, the reports are that it's probably a good 18 months away until the government steps in on front of package labeling. In the meantime, Nutrition Keys, we've got NuVal, we have Guiding Stars. They're all vying to see who will be front of package, but bottom line is 18 months from now, probably the government is going to have to step in and make their recommendations and their changes. There's no question in my mind, having just spent the past week with a bunch of in-store dietitians from supermarkets around the country, that consumers are confused with front of package labeling and the claims that are out there. So if in fact we're going to succeed as an industry and be able to take the lead on it, not have the government get involved and dictate what exactly should be on there, we have to keep things simple and clear. That's serving size, it's sugars, it's fat, it's sodium content, and frankly, the nutrients to encourage, that's getting even more confusing for consumers that are out there today. Let's see if we have any other questions. Why do you think such a large number of diagnosed diabetics do not change their eating habits? That's from Joe. Joe, that's a question that is a follow-up for our consumer panel. We were very shocked to see that once somebody has been diagnosed, that they're not changing their eating habits. That's absolutely absurd. And as we said, it's really an opportunity for supermarkets to be able to take the lead and to be able to help the shoppers. Number one, confusing information. Number two, and this goes back to what we saw for diabetics in the old SD candies, if you would. If you think back 20 years ago, it was in a special section in the store, and people felt ashamed, if they would, that they were diabetic and didn't want to be able to tell other people when they went to that department that's what would happen. Now, the world has changed dramatically, and I'm not sure if people are still ashamed of having diseases, but I think that plays into it a little bit too. The diabetic rules are relatively simple, but again, I was just with David Katz, Dr. Katz, the other day from Yale, and he was pointing out that now we're seeing more early teenagers, 10, 11, 12-year-olds, getting type 2 diabetes. And as I pointed out, probably one of the biggest scams, the scam is the wrong word, but what bothers me a lot is as children started getting type 2 diabetes, to make it sound better, they changed the name instead of adult onset diabetes to type 2 diabetes. Well, maybe if we kept the name the same, adult diabetes, and we had a 10 or 11 or 12-year-old getting it, maybe we'd pay a lot more attention to these people and really understanding. I guess we have this discussion all the time. Do you want to call people fat and it's not politically correct? Do you want to say they have adult onset diabetes? That's not politically correct. Well, maybe we need to shock people a little bit to really get their attention. But a follow-up on our consumer panel is going to really dig deeper into why these people who have diabetes are not changing their dietary habits. Because it's a shame. And again, if you look at the stats, just 7% reduction in body weight can prevent diabetes. Getting out there, moving like the Let's Move program, eating better. We really need to get people in shape. And again, all goes back to obesity. Also, Dr. Katz was talking about that now he's starting to see patients, young kids, 10, 11-year-olds who are having strokes. So this is a huge problem. And unless we can really wrap our arms around it as an industry, it's just going to get worse and worse. And everybody talks about healthcare reform, and as I'm sure you know, and it's been said before many, many times, we cannot afford obesity, in our system. When we look at the price of healthcare now, just wait for another 10, 20, 30 years as these very overweight children are going to become overweight adults. We're just not going to be able to afford healthcare for them. Let's go back and see if we've got any more questions. It doesn't look like we do. So, with that, I want to thank you all for joining us for Food News Today. I'm Phil Lempert. Thank you. And if you have a colleague in retailing, the media, or a blogger who would also like to receive our advanced email, please ask them to visit us at foodnewstoday.com to sign up. Next week's stories will be in your Tuesday email. And also, don't forget, in about an hour and a half from now, this archive will be posted in our archive section. It'll also be on YouTube. And anyone that you might want to have seen the program, who missed today's program, you can just send them that link. So thanks again, and we'll see you all during the week.